This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about why your wrist hurts on the thumb side and 4 possible reasons that it does. If you like this video, we put out new content weekly, so please like and subscribe. Alright, so there's 3 main reasons that can cause kind of chronic pain along this side, and there's one reason that can cause kind of acute pain or like from trauma. We'll start kind of with the most common. So sometimes some people can have something called a trigger finger, where basically the tendon that slides through any of the fingers, but in this case the thumb, gets kind of stuck right here. And most of the time that's pain right over here, but there is occasions where that pain can kind of travel all the way around into the back of the thumb and almost down to the wrist. Most of the time trigger finger is pretty straightforward, but there are a lot of strange presentations of it. So that's definitely one reason you can have kind of pain in your thumb side around this area. The second reason, this is more towards the wrist, is something called de Quervain's tendinitis. So there's these small muscles that move the thumb, and these muscles are attached to tendons that travel right down through the hand right here. So if you have pain kind of right at your radial styloid, we call it, like right at this point right here, kind of right beneath the thumb, and it hurts when you do this, you might have tendinitis in that wrist called de Quervain's tendinitis. That usually responds pretty well to stretching, like a trigger finger as well responds to stretching. Injections are the next line of treatment, which in the case of trigger finger or de Quervain's can actually be curative, meaning that it can cause it to go away and never come back. And then sometimes you can splint these as well if the pain's right here. The third reason why you might have pain in your wrist on the thumb side is this is more common in kind of females in their 50s or 60s. Basically, they'll get arthritis at this thumb joint here called the thumb carpal metacarpal joint, or CMC joint for short. And that's just kind of a degenerative arthritic condition. That hurts more if you kind of move your thumb back and forth between your fingers. If you get pain kind of right here, that's usually what that is. A simple x-ray will tell you if that's what you have or not. Although a lot of times you can make the diagnosis before you even have the x-ray. But x-ray is definitely helpful to confirm. That is something that sometimes people wear some wrist splints called CMC wraps, which may help with the pain. A steroid injection is not going to cure anything, but sometimes people get 1 or 2 of those a year and they can get by for a while. And of course, if all else fails, there's a surgery to fix that. The fourth reason why you can have wrist pain, if let's say you fell, sometimes you'll break a bone called the scaphoid, which is a bone that's right here in your wrist, and that can cause wrist pain. Sometimes that can be more center of the wrist, but sometimes it can also be towards the thumb side, depending on where you break it. And that's something that doesn't always heal correctly, so definitely need to get x-rays to make sure it's there. And even if you break it and get x-rays right away, sometimes it doesn't show up on x-rays till 2 weeks later. An MRI scan or a CT scan will show you finer details of that. That's something that if it's displaced at all, definitely needs surgery. If it's not, then you end up being casted for a very long period of time. But usually that's some sort of trauma. You have to kind of basically fall to get a scaphoid fracture. So to sum it up, most common causes of wrist pain on the thumb side: trigger finger, de Quervain's tendinitis, thumb CMC joint arthritis, broken scaphoid. So I hope I was able to answer your questions about why your wrist hurts on the thumb side. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you specific medical advice about your specific condition. Again, if you like this video, please like and subscribe, and thanks for watching.